Hello, my name is Leah Murphy, and I'm an FNP student at UT Health Houston Cizik School of Nursing. And this presentation will go over how to perform a bone marrow aspiration and biopsy. I hope that by the end of this presentation, you'll understand the clinical indications of bone marrow analysis, the pathophysiology of bone marrow, the risk factors and contraindications, the steps of a bone marrow biopsy and aspiration, patient care and teaching before, during, and after the procedure, how to prepare the specimens, and then how to interpret the pathology results. A bone marrow analysis can be used for a variety of different reasons. It can be used to diagnose a hematological malignancy or disorder, and then later it can be used to determine whether or not a treatment for that malignancy or disorder is being effective. It can also be used as a measurement of engraftment for patients who have received an allogenic bone marrow transplant. And then finally, it can assess immunodeficiency diseases and infections in the bone marrow. The bone marrow contains pluripotent stem cells, which are also known as hematopoietic stem cells, and these cells are precursors for all of our different blood cells in the body. So as these cells mature, they stay in the bone marrow, and then when they're mature enough, they're released into the bloodstream to perform their specific duties. So when you're looking at a peripheral blood smear, if you see these immature forms of the blood cells, it usually indicates that there might be a problem. Bone marrow is located in all of our bones at birth, and then as we age, it becomes consolidated to the axial skeleton, which includes the sternum, vertebrae, ribs, clavicles, skull, pelvis, scapula, and the proximal ends of the femur and humerus. So the most common site for a biopsy in adults and children is the posterior superior spine of the iliac crest, but the anterior iliac crest and the sternum can also be used if the patient for some reason is morbidly obese and can't get into the correct position, or if the site's been previously irradiated and would produce suboptimal specimen collection. Also, in infants under 18 months whose iliac bone has not completely ossified, the anterior tibia can be used. But for the purpose of this presentation, I'm going to describe the procedure using the posterior iliac crest as the biopsy site because it's the most common site used, and using the sternum increases the risks of the procedure due to the fact that it's such a thin bone and because it's so close to the heart and lungs. That biopsy should probably be performed by a physician. So I like this graphic because it shows how the hematopoietic stem cells differentiate and then where all the cells live, whether they're in the bone marrow or in their mature form in the blood. So for example, if you have a patient with leukemia, on their CBC, they'll have a very, very high white blood cell count. And then when you look at the blood smear under the microscope, it's filled with these immature white blood cells like the myeloblasts or the lymphoblasts. And these immature cells cause problems because they don't function correctly and they tend to crowd out the healthy and mature blood cells. So prior to performing the procedure, informed consent must be obtained, and the patient needs to understand all the possible risks associated with a bone marrow biopsy, which include bleeding, infection, persistent pain and neuropathy post-procedure, and then fracture if the patient has weak bones, such as those with multiple myeloma or osteoporosis. Osteomyelitis is also a risk. And then if you're doing the biopsy in the anterior iliac crest, retroperitoneal hemorrhage or bowel perforation can happen. Really rare conditions are tumor seeding, where the tumor follows the needle path and dissipates into surrounding tissue, and then needle breakage. Patients that need special precautions are those with bleeding disorders and those patients with the weakened bones. And then in addition to all of this, they need additional laboratory testing such as CBC, PT-INR, PTT, and possibly an iron panel. Here are the supplies needed for the bone marrow biopsy. Oftentimes they're included in a bone marrow biopsy kit, so you don't have to go searching around for all of them. But keep in mind that this is a sterile procedure, so you need to maintain sterile technique throughout the whole procedure. The procedure is performed using local anesthetic for adults, and in children, conscious sedation can be used. The patient should be positioned in lateral decubitus or prone position, with the biopsy site cleansed and draped using sterile technique. When injecting the lidocaine, start superficially with a smaller gauge needle and then move to a larger gauge when anesthetizing deeper tissues. It's also important to talk to the patient and explain the process as you go. This helps keep their anxiety down and they know what to expect. So to collect the bone marrow aspirate, first make a small incision in the skin and insert the aspirate needle at a 90-degree angle until the periosteum is reached. Then direct the needle laterally into the anterior superior iliac spine by using a twisting motion until a give is felt as the needle enters the bone marrow cavity. This may cause discomfort for the patient, so you should warn them prior to doing this part of the procedure. So once the give is felt, advance the needle a little bit further to ensure that it's in the correct space, and then remove the stylet in the middle of the needle and attach a 10 cc syringe. Aspirate 0.2 to 0.5 cc's of bone marrow, which can also cause the patient pain, so warn them prior to aspirating. Avoid aspirating more than 0.5 cc's per syringe because it can dilute the specimen, and if the sample clots too quickly, it can't be used, and it's only a small amount that's wasted. Collect the amount needed to perform all the testing ordered on the specimen, and then reinsert the stylet and remove the needle using the same twisting motion. After the needle is removed, apply pressure to the site using sterile gauze. So here's an image of a patient lying in prone position, and then also an image of what the bone marrow aspirate looks like. And it looks like that syringe is overfilled. So in order to get the core biopsy, you're going to use a Jamshidi needle, which looks similar to the needle used for the aspirate, but it's longer and has a bigger bore. The process of inserting the needle and penetrating the periosteum is the same. The same incision should be used, but the needle should be inserted in a different spot than the aspirate needle. Once the periosteum is penetrated, the stylet is removed and the needle should be advanced an additional 15 to 20 millimeters. Then gently move the needle side to side and twist it 360 degrees clockwise and counterclockwise to ensure the biopsy is separated from the surrounding tissue. Then, before removing the needle, push it in a few millimeters further. This will ensure that the biopsy doesn't slip out of the needle as it's pulled out. Again, apply pressure to the site with the sterile gauze once the needle is removed. So once all the specimens have been collected, you're going to continue to apply pressure to the site until the bleeding has stopped. and then apply a pressure dressing to the site and instruct the patient to lay supine for 15 to 30 minutes before they are discharged. Instruct the patient to keep this dressing dry and intact for at least 24 hours post-procedure, and advise them to call if they experience any signs of infection or bleeding. The patient should be contacted 24 hours after the procedure and then again in 1 week to ensure that they are not experiencing any adverse events. The bone marrow aspirate can clot quickly, so having someone in the procedure room processing the specimens as they are collected is advisable. Usually this would be someone from the laboratory, as they're trained on how to make the slides and process the specimens for the various tests that may be ordered, such as flow cytometry, immunophenotyping, cytogenics, and molecular diagnostics. Just make sure that, unlike in this photo, the lab tech is wearing gloves. Once the specimen goes to pathology and is resulted, there will be a pathology report. This report usually contains an assessment of the cellularity, which reflects the quality of the specimen, and there will be a myeloid to erythroid ratio, which tells us if there's an increase or decrease in the number of granulocytes as compared to the red blood cells. There will also be results for any other testing, such as genetic testing for mutations or cell markers. And then towards the end of the report will be the pathologist's impression. This usually contains the patient's diagnosis and any recommendations of further testing if applicable. So when looking at these results and the clinical background of the patient, you can develop a treatment plan for the patient and implement it.